There are two tests used for placement, the non-word reading test and the irregular word reading test. Both have to be administered and scored before the placement rules can be used. Use the error analysis form at the back of the non-word reading and placement test to determine the appropriate starting point for each student. Progress can be monitored sufficiently just using the non-word reading test and the irregular word reading test. However, other measures of ability such as a sound spelling test and a test of grapheme phoneme conversion rules is included for completeness. Most teachers won't have time to administer these, and it is very sufficient just to use the non-word and irregular word reading tests. Instructions for how to prepare the sound cards and the irregular word reading cards are included in the written Getting Started instructions. It is possible and, in fact, preferable to run the program without these cards. Follow the instructions in the irregular word reading and sound card videos. It's wise to practice teaching the program with a single student. That way the teacher can become a master over the scripts and understand what has to be done and how it has to be taught before they have to deal with the more complex issue of managing group dynamics. Teach one lesson per day. Even if you have extra time set aside for the lesson, don't go on with a second understanding words lesson. If you do have additional time, you can spend it talking about vocabulary or doing broader book reading or some other worthwhile activity. Don't go on and do a second lesson because you'll end up teaching something new that the students don't have time to master, and you'll have to go over it again the next day or lesson anyway. Each lesson includes a number of different activities labelled alphabetically. For example, Lesson 1A, Lesson 1B, and so on. Pause this movie and open the teacher booklet Level A to Lesson 1. The activities in Lesson 1 are labelled alphabetically, Lesson 1A, 1B, and so on. The materials section of each activity can be found under the activity heading. The materials will tell you exactly what you need to teach that activity. In a lot of cases early on in the program, it will tell you that you just need the teacher booklet. In other cases, it will tell you that you need a teacher booklet and the whiteboard or a mini whiteboard for the students. Where the materials section tells you that you need the student booklet, open the student booklet and find the relevant lesson number and activity in the student booklet. You will then see the reading material that the students are to engage with for that activity. Each script has text written in blue and black text. It's very simple to follow them. You simply read aloud what's in blue, and what's written in black is either an answer, if it's in brackets, or a direction to do something. So you simply read what's in blue, do what's in black. It's most important that you don't change the scripts at all. Many years of work have gone into making sure that the scripts are explicit enough for the students to understand what it is that they're expected to do, but also to make sure that they don't have any extra fluff in them that could be confusing to the student. Read the scripts, follow the scripts, say and do exactly what they tell you to do. When you go off script, you tend to lose the clarity in the teaching, or you make assumptions, or what I call teaching errors, and you muck things up for the student. Must stay on script. The only exception to that is correcting errors. You will see in Lesson 1A that there are some activities that have text within a grey shaded box. those boxes give you suggestions for how to correct errors. But it's very, very difficult to script for correcting an error. It can depend upon the dynamics within your group, or if you're teaching with an individual student. Students have different personality characteristics. They can be having a good or a bad day. So some days you'll be able to make fun with them. On other days you have to be deadly serious. So treat those scripts as a guide. Correcting errors typically comes with teaching experience. So once you get used to running the scripts and they're being run almost automatically, you will develop your own methods for correcting errors that are sensitive to each child. Where you see a letter or letters within forward slashes, that always represents a speech sound. I haven't used the phonetic alphabet because no one understands it. I've simply used the letter or the letters that most commonly make that sound. So, for example, if you see P in forward slashes, just think, what sound does the letter P normally make in a word? It's typically P, like in pat. Or if you see the letters U, R within the forward slashes, think, what sound do they normally make in a word? It's normally like in turn. Remember that the purpose of the teaching scripts is so that you can be very explicit in terms of what's required of the student. But once they understand what to do, which will actually happen quite quickly because the same sorts of scripts or activities continue over and over through the program, you can actually stop giving the script. Remember that the scripts can actually be quite lengthy, so if you're insisting that you give the same script over and over when the student actually knows what to do, you run the risk of annoying them. You also run the risk of extending your teaching time. So be efficient. Once your student or your group of students understands what to do, you can allow them just to take on the activity themselves. The program is written with very young students or the most severe cases of reading disabilities in mind. The assumption in those cases is that the students know absolutely nothing before beginning the program. So in those cases, you should begin on lesson 1 and teach the program in a very strict sequence. That way there's no assumptions about what the student might know. You're teaching them the language of instruction very explicitly, again with no assumptions, and they're able to master each step along the way. In practice, a learning support teacher or a parent clinician will actually be working mostly with students who know some things but in fact have gaps in their learning, if you like. The placement rules allow you to start these students at different points in the program, and the introduction lessons at each of the different starting points ensure that you're able to adequately teach the language of instruction and important procedures before starting the program proper. It is also okay to be somewhat flexible in how quickly you go through elements of the program. So for example, if you have a student who has clearly demonstrated through the placement procedures that they know the grapheme phoneme conversion rule for the letter J, and they can use that to read and spell words, then when you get to that activity, move quickly through it. So let's say there's a word reading activity that has 20 items in it, do 5 of them. If there's a spelling activity that has 6 words in it, do 2 of them. As long as the student's able to easily demonstrate that they've mastered or can apply that particular rule, move on. So just as an example, pretend that you're teaching the OR grapheme in one lesson, then in the next lesson you're teaching the J grapheme followed by the OR grapheme. It's okay to skip quickly through the J lesson and get on to the actual thing that you need to teach, in this case maybe the OU grapheme, in one lesson. Don't waste time on things that the kids already know, but equally it's probably important not to skip lessons completely, because often those lessons are not just teaching, in this case the J grapheme, they're giving additional practice in previously taught or learnt letter sound rules. So go through them quickly using a more limited number of items rather than skipping them completely. The reading comprehension program is for use with students who have oral language weaknesses, particularly those in vocabulary and grammatical sensitivity. There's no need to use it for students who just have dyslexia or word level reading problems. For those students, reading comprehension will improve as their ability to read the words on the page improves. When you're concerned that a student isn't responding to the program, or a class teacher reports that they're not making improvements on classroom tasks, is to consider how you're measuring the improvement. Remember that the program teaches very specific word level reading skills. It's attempting to teach specific words in the case of the irregular words, and letter sound rules that allow decoding at the word level. Therefore, the most relevant form of assessment of response to the treatment are those specific curriculum-based word level tests that are provided with the program. You actually won't see all that much transfer to classroom tasks, at least in the short term, particularly in complex cases. The next thing to consider is the intensity of the treatment. Are you running the program often enough? So if the program's being run once, twice, 3 times a week, it's a bit like taking your antibiotics once a week. It's not really going to work. It needs to be run a minimum of 4 times a week. Then you can consider the makeup of your group, provided you're running it in a group, of course. So is the group unruly? Are they difficult to manage? Is the particular student you're concerned about being lost in the group? Is the group being managed appropriately? Particularly, are the students getting enough learning trials? If you have a group of 4 students and the group can't be managed so that they all respond together, then essentially the number of learning trials per student equals the total number of learning trials divided by the number in your group. So some students can actually only be doing, say, 5 or 6 minutes worth of work and maybe 10 to 20 learning trials in an entire lesson. Clearly not enough. In those cases, you either have to change the makeup of the group, get a supervisor to look at how you're managing the group, or change the instruction to one-on-one. Another potential issue can be the way the program is being taught. Perhaps the scripts are being changed or the sequence of the program is being modified. If that's the case, or there are concerns that that's the case, get a supervisor to watch your teaching and to provide feedback. Finally, it's often a combination of teaching errors and student characteristics that are causing the problem. It's rare to find a student who just has word level problems. They typically present as complex cases with additional weaknesses in oral language skills, particularly in attention, and sometimes in intellectual status and behavioural problems. It's important for the teacher to identify these coexisting problems early and put plans into place to deal with them, because they really will affect response to intervention. That's where additional referrals and assessment can be important. For example, we know that attention problems have a significant negative effect on response to reading interventions, and we know that treating attention problems significantly improves response to intervention. So for those students who have notable attention problems, one needs to consider making referrals and treating that part of the case. Similarly, we know that oral language problems are an additional risk factor. Not only do oral language problems affect reading comprehension, but they also have some effect on the learning of specific word level skills, particularly irregular words. It is hardly necessary to make comment on the problems that oppositional and defiant behaviour will have on not only on a group but also on the individual child's response to any kind of educational intervention. And where there are those problems, one needs to be making referrals for behaviour therapy for the family, and perhaps asking for consultation from a behaviour specialist to help come up with strategies to manage the child's behaviour within the reading intervention session.